At Australian Sikh Association, our main aim is to help communities in need, whether it's a bushfire, flooding, or the current COVID pandemic. We believe that no one should sleep empty stomach. So the first thing we started was a takeaway foods at the gate from 6 to 8 p.m. during the lockdown. So every day we serve around 400 to 500 cooked meals to anyone in need, no bar of caste or age or where you come from, including the takeaway deliveries. Now, while all these was were happening to support the communities, we came with the thought, wouldn't it be great if we can assist our people, our community with more by having a vaccine pop-up, including the testing center. So we approached the local district health authorities, and we were very happy to hear that though the testing clinic is on hold at this stage because they picked the Parkley food market, but they were happily able to provide us the vaccine at the clinic. So the day we received the common myth, the reason we reached out to the local health authority was there was a common myth that people aren't getting enough. So we thought, wouldn't it be great if locally where they come and where they worship, if we offer them, they'll be better. And to our surprise, rather shocking, within 3 hours, we received over 350 expression of interest who would want to take this vaccine. So I have to close the Google form. And so far we have done the 2 sessions, the first on 22nd of July and the second on the 27th of July, and there's upcoming on 26th of August. So people are really, really happy, appreciating. And now there are a number of reasons why they were not going to the home.
Let's come to the rollout in a moment. I just want to ask you whether you were surprised that you needed to approach the local health authorities with this idea, given the role that the Sikh Association has played over the course of the pandemic, as you say, in terms of providing food and also resources at the beginning of the pandemic. So were you surprised that you needed to make that outreach instead of it being the other way around and trying to get multicultural community leaders involved?
I think at this stage, I would say it was a combination of we were talking to the multicultural and the local authorities. And while we were discussing the testing center, they came up with the testing center and we said, okay, what about the vaccine itself as well? So I would say at this stage, it was initiated at both levels.
Okay. Why did your community have concerns about having the vaccine?
I think there's a complex issue. I think the first is it could be the English, or the second is, and I don't want to be put a tag at a government, but I don't think there was enough information out for the community to really understand. I think people were scared what would be the impact of taking a vaccine, especially the AstraZeneca. So by just having this clinic here, it really gave us that reach to go out to our community and make them feel that, yes, you are in the comfortable hands.
So the uptake has been rapid, which is great. Are you being given the amount of vaccines that you need to meet demand?
The answer is no. There are hundreds and hundreds of calls coming to all of our directors who are doing a volunteering service at the temple. The answer is no. We are trying our best to negotiate with the government. Please give us more vaccine. There are people, could be the English as a barrier, or they're not able to travel to the central Homebush hub. So right now we are running very, very short on the vaccine, at least at this pop-up clinic.
Yeah, so we know that access is key, and if people can get a vaccine locally from someone that they trust, they're more inclined to get it. Is that the sort of feedback that you've been hearing? Are the volunteers that you have there able to dispel some of the myths that people have around vaccines when it comes to COVID?
Exactly, spot on. That is the case. For example, some of us would talk in our own Punjabi language, and others saying, are these people saying it for real? So we'll show them that, yes, I was the first one to take the vaccine. So that kind of set the precedence. And I would say to the other local member of parliaments and other senior leaders as well, take the vaccine, tell it to the people, and I think they will have more trust. Same apply to our community. So there was a hesitation when we started this initiative, but the minute we said we will be the first one to take the vaccine, they were really happy and they were coming forward to take the vaccine.
Okay, so are you administering Pfizer or AstraZeneca there?
At this stage, Pfizer. But we are also asking the health authorities that if AstraZeneca can also be made available. I don't think there is any shortage of AstraZeneca, but I think there's a bit of a long journey of convincing people that there's no difference in the vaccine. And I think we need to get rid of those myths that AstraZeneca is less effective or more less effective than Pfizer, especially in the elderly community.